Hello, this is Dr. Natalie Lenor Blackman, and I am coming to you from my sunroom at my house. And if you're watching this video, it is because you have recently scheduled an appointment with us, and we are so excited to have you. And just due to the pace of our clinic and the fact that there's just one of me, I wanted to make an introductory video to talk a little bit about what we do at our office. And so at Wellbeing Medicine, we are a holistic clinic. Yes, integrative, but primarily holistic. Our goal is to help you on your journey, wherever you are on that healing journey, with your pet. And so most people find us after they have had their own aha moment in their life, whether it's their own health or their children's health. And so it's not uncommon for people to all of a sudden realize, oh my gosh, if I'm doing this for myself or for my child, I should also be doing it for my pets. And so that makes us very happy when people come to that conclusion, because they are a dear part of our family. And I don't know what we would do without them personally. So our goal at our practice is to help your pet live their best quality of life possible. And in order to do that, we have to restore health. And because sadly, the current system is making our patients or pets sicker. And so just like in the Western world, or for the human side, we say, unfortunately, most of the medical system is a sick care system. It's very similar, unfortunately, with the pets. And so pets will go in for their annual visits, where they receive anywhere from 5 to 8, sometimes 9, depending on the vet clinic that they are going to, 5 to 9 vaccines. And that's because they'll either do a 5-in-1, a 7-in-1, the rabies, sometimes the flu, sometimes Lyme, and hopefully not the rattlesnake vaccine, but that also occurs as well, and then Bordetella or kennel cough. And so those pets are going in and getting a whopping dose of immune stimulants, because that is what vaccines are designed to do. They're designed to trigger our immune system, and there are adjuvants within those vaccines, and most of the clients that come to us already understand this, but adjuvants are things that are added to the vaccines to also get a response from the immune system. So those are aluminum, formaldehyde, mercury or thimerosal. Sometimes there's egg yolk, used to, and I don't know if they still are, but had soybean oil, like things like that in those vaccines to trigger an immune response, while at the same time that is making our pets very sick, because the heavy metals are hard for the body to clear. They also bind to the nervous system. They get pushed into the fat, where they stay for a very long time. And then those antigen antibody complexes get, the body gets overwhelmed with how many there are, especially after repeat vaccines. And those get lodged in both the kidneys, as well as the joints. The body actually just has to push those antigen antibody complexes somewhere to store them. And so that leads to glomerulonephritis, or kidney disease, when our pets get older. Leads to arthritis as well when they get older. But we also, because of this massive immune response, we see our pets developing not only allergies. That's what we treat 90% of the time in our clinic, is allergies. but we see allergies from those autoimmune reactions as well. And then cancer, unfortunately, is the end stage of that type of immune response in the body. So our goal is to help you understand how we can limit those vaccines through vaccine titer testing. And I am going to have other videos on that, but that's where we measure the antigen or the antibody complexes. And so we can give you an estimate of how protected your pet is. So I tell people it's like looking on the inside of your pet, just like with an x-ray or an ultrasound. Wouldn't you like to do that if you knew you had something wrong, right? You don't want to just guess if you have something wrong. So why should we guess if we have antibodies to these viruses when we can test for those? So we try to encourage our clients to do more vaccine titers. We do run those in-house, so it makes them much more affordable than what regular veterinarians charge when they send those outside to an outside lab. So we want to talk to you and encourage you about vaccine titers. And we also want to talk to you a bit about flea and tick medicine, because the majority of the people that are coming to us for a problem. And I tell clients now that I don't really treat diseases anymore. I just treat side effects. And those side effects, unfortunately, are related to the oral flea and tick meds that we are seeing ramp up. And we've just been seeing that in the last decade. So 10 to 12 years, those really moved into the market. And I can tell you there is a delineation between the patients that we saw before those oral flea and tick meds to the patients that we see now. And in fact, I have been working very diligently, and I am almost to the finish line of putting together my detox protocol that I want to launch online and hopefully help more people than we're able to help in our practice, because it is an epidemic. The sick pets that we are seeing from this issue with these pesticides being taken internally rather than just being taken externally. These are getting caught up in what's called the hepatobiliary circulation. And so the pesticides are not cleared by the body. They're not meant to be cleared because they're actually meant to bind to a protein so they can stay within the body for at least 30 days. And the Bravecto is 90 days. So that chemical binds to a protein in your pet's body, and it is meant to stay in the body. Okay, I want you to think about that. The pesticide is meant to stay in the body. And so because it is a pesticide and it is a chemical and it is a toxin, the liver works overtime trying to get rid of it, even though it can never get rid of it. It is constantly in this hepatobiliary circulation all day, every day, and that ends up wearing down the liver. And we call the liver the general of the body. In Chinese medicine, he is the most important organ. I don't want to say the most because we can't really pick. They are all important. But we do put him at the top of the list, okay? And over my last few years, I would say last 10 years of really looking into my patients, and especially the ones that come to me that have had oral flea and tick meds, I've really found the gallbladder to be just as equally as important, but actually the gallbladder is the one that gets the most affected from these pesticides. And then we see a binding of the taurine that is meant to make bile in the gallbladder, and that is triggering seizures in a lot of patients that have been on these oral flea and tick meds. And so we've got a gallbladder being affected, and then we also have the liver being affected. So I like to give you this information ahead of time because I do have some clients that have come into our office, and when I begin to talk to them about these oral flea and tick meds, a wall comes up and they're literally like, nope, I like this convenience. I want to continue using these meds, and you're not going to change my mind. And that is really hard for us at our practice because we're never going to get the pet well when the reason they're coming to us is because they're having side effects from these actual chemicals or these pesticides that are being taken internally. There are lots of ways we can help you prevent fleas, treat fleas. If we need to use chemicals, there's ways to use them safely. If we have to use an oral flea and tick med, there are safer ones. And so we do walk each person through that step by step. We are not here to treat our patients or our clients like a herd mentality. We are here individually for each family and each pet, and we take everything in your life into consideration. We're not here to say one size fits all. As well, we do not do that with the diet either. People come to me and they're like, oh, I know that raw is the best food on the planet and I need to feed raw. I'm like, no, raw is not the best food for every dog. So, we have to take into account lots of factors. So that pet's constitution, their age, how well their digestive tract works, where the liver and the gallbladder is, and even where the pancreas is, because a lot of these pets that have been in this cycle of sick care system do not need to just go directly on to raw food. We have to actually help heal that system, because we have what we call leaky gut syndrome from over vaccinating, and so that's actually called spleen qi deficiency in Chinese medicine, which means a weak digestive tract. It also means we have a digestive tract that is leaking proteins, and so we have to be careful what we feed a pet that is experiencing leaky gut. And so we have to take into account that not every pet is going to be the same. Not every diet is going to be the same. Not every recommendation is going to be the same. And in fact, it's quite the opposite. And that's why I've worked really hard on this detox protocol, because I have been so individually based with my patients over the last decade or so that it's hard for me to even say, okay, I'm going to put something together that I think can help multiple pets. But I have been working on it very intensely, let's just say that. So I'm hoping that it will, fulfill what I hope that it will fulfill, and that is to help more pets, okay? Because we want to help as many pets as we can at our office. It's something I think about on a day-to-day basis. It overwhelms me when I think about what's going on in regular practice, because I myself used to be in regular practice. I was in emergency medicine for almost 10 years, and then spent several years in day practice. Primarily when I did day practice, I focused on dentistry and some surgery, but I did a ton of surgeries when I was on emergency medicine over those years, and so now I'm trying to help heal the pet from the inside out, instead of us having to do emergency medicine or emergency surgeries or emergency treatments. Our goal at our office is to heal the body, to restore health and balance back to the body. Our ultimate goal is to prevent disease. I mean, that's what makes me extremely happy. But we do most often end up just treating disease. And again, we're not usually treating disease. I'm usually treating side effects. And those side effects have caused diseases these days. One day, just to give you an idea, one day in my clinic, I had 3 different dogs in 3 different exam rooms at the exact same time that were all suffering seizures after they had received the oral flea and tick meds. Just in one day at one time. Okay, that wasn't throughout the day. That was all at the same time. So that's how frequent these side effects are. And I feel like I am in the ocean with a spoon, and I'm just, helping, one patient at a time, which is dear and near to my heart. But we've got to get more of this information out for others. And so if you have friends or relatives that are using these chemicals, don't know what happened, but if you have friends or relatives that are using these chemicals, we want to encourage you to open that conversation with them so that we can begin to help them and we can prevent the very scary long-term effects, which are seizures, and those can last, for life. Strokes, that's extremely common, and sudden death is also very common. So we've had a wide range from the most common side effect to the oral flea and tick meds are villus vomiting syndrome or episodic vomiting syndrome, and that's where, if you open the conversation with someone, they may say, does your pet vomit often? Oh yeah, they usually vomit a couple times a month, but my vet said that was normal. Well, no, it's not normal, and it never was normal, and it only became normal after we started giving these oral flea and tick meds. So we really want to try to help spread that word out there. We want to really help reduce this toxic load that our pets and patients are under. And it does wear on me. It's something that I really want to see a change in our system, and I pray that we do. But we say in our practice, each one reach one. And so it takes people opening up those conversations and really trying to share with others, that there is a different way. There is it may not be the most convenient way, okay? But I tell people, do you want convenience or do you want a live pet? I mean, you can have convenience and a dead pet, or you can have a little bit more work and a live, healthy pet. And it's not uncommon for people to come into our clinic and see a 14, 15, or even 16-year-old dog walking out of an exam room and think that they're 6 or 7. Because our patients, we have worked very hard with them over the last, decade, really helping to what we say at our clinic is reverse aging. Okay, that's very important. It's important for us. I really believe in that. And it's important for our pets. And so that is one thing that we really try to help, you learn about, and we try to help encourage at our clinic. And so you'll hear us talk often about reverse aging. That's our goal, and that's where we are working to rebalance the body, restore healthy lymphatic flow in the correct manner. And I will have other videos, hopefully, where I will go into how the lymphatics flow through the body in a 24-hour period, how they flow through the body in a full yearly cycle. All of that matters, right? So if we are able to restore lymphatic flow, in Chinese medicine, it is said, where the lymph is free flowing, there is no disease, okay? And also there is no cancer, because cancer is a result of congested lymphatics, or what we call phlegm congestion in the body, okay? And that's usually what triggers, tumors and oncogenes. And so we get a lot of stagnation, and think of the body like backing up, like a system is backing up. It can no longer function. It's a computer backing up, and it's going to dysfunction, okay? So disease is dis-ease. It is dysfunction. And so we try to help our patients restore proper lymphatic flow. We do that through acupuncture. We do that through supplementation. We open up the lymphatics, and then we detox, okay? So there's a proper way to detox. That is very important in our office. There are actually times of year that we detox more. That's the spring season and the fall season. But I personally detox year-round. I have dealt with something called the NTHFR gene, and that's where I do not detox properly. Some people watching this video may have been told that they have that gene as well, or they may have 2 genes for that. And that person, if you have the 2, you really need help detoxing. And so that's really important in our office, because over the years, through certain tests that I run, one particular called the bioscan, I have found that dogs and cats also are having issues with this gene. and they are not detoxing or methylating correctly. And so this is why people may say, well, I've given my pet, this chemical every single month for 5 years and I've never had a problem. Well, that is fantastic, because your dog probably does not have an issue methylating, okay? But you're still, even with a pet that is able to methylate properly, you're still playing Russian roulette. But if a pet does not methylate well, or that gene is triggered and they are now no longer able to methylate well, then those pesticides will accumulate in the body and they will begin to have some of those horrible side effects that can come in a wide range of issues. As we talked about, the Bill's vomiting syndrome, we can have gastroenteritis or chronic hemorrhagic gastroenteritis, which is where we have intermittent issues with bloody mucousy stools. Sometimes that'll happen 1 or 2 times a month. It can be 24 hours after giving that med. It could be a week after giving that pesticide or, oral flea and tick med. And so sometimes we just have to help our clients put that picture together so that we can begin to restore health back to the gut. And then, as we talked about, the gut can stop working completely. We've had that happen where dogs have had multiple abdominal surgeries. We can also have, as we talked about, the leaky gut that gets worse and worse through these oral flea and tick meds. We have gallbladder problems. We have liver shutdown. We have seizures, strokes, sudden death, and also neurologic issues based on how those pesticides over time bind to the myelin sheaths that cover the nerves. So those are the huge list of the complications that we can have. And so this is why at our clinic we talk extensively about detoxification. But there is a correct way to detoxify. We can't just detoxify a patient that does not have open lymphatics or that is out of balance. So we begin to restore open lymphatics or open lymph pathways. Then we work on detoxing, whether we do a detox phase 1, phase 2, or whether we're just going to do a really good detox. Then we work to restore cellular communication, because we actually have cells that are from the chronic pesticides and or heavy metals from those vaccines. We have the cells no longer communicating properly at all. And so that can even make detoxing hard. So sometimes we will increase or use supplements to help with cellular communication. I have been studying the body for as long as I can imagine. I mean, I was, 10 years old, and this is what I cared about, and I'm almost 50. And so I've been studying this for a very long time, but I've been studying my patients very, very closely for the last 22 years that I've been in practice, because even when I was doing emergency medicine and critical care, I was already training in Chinese medicine at that time, and being holistic as it is, I was always interested in the body and pathology of disease and why things were happening the way they were and what we could do to correct these issues. And cellular communication has been something that we have watched worsen over the last, probably since, of course, the oral flea and tick meds when they came on the market about 12 years ago, but also with all of the toxic exposure that we have in our environment. We've got glyphosate, we have atrazine, we have the increased vaccines that the pets are getting regularly now, and we've got the pesticide use that they're taking orally, as well as the pesticides on the lawn. And then we also have to take into account that we have EMFs in our environment. So we've got a lot stimulating this, our bodies and our pets' bodies, and so that affects how the cells communicate. So we're going to work on restoring cellular health as well, so that they can communicate better. At our office, we really try to treat according to the seasons, and that is because each organ system will have a time of season of the year that it expresses itself or should be expressing itself. And if it is unbalanced, we're going to see problems there. So we may begin working on a pet and everything's going great, and we move into another season and they absolutely go haywire or fall apart or regress. And so that allows us to know, okay, we've got to adjust our protocol now based on the fact that it's the heart season. or it's digestion season, or it's the lung season. And this may sound completely foreign to you, and you may say, this sounds crazy. But I have studied this for, like I said, over 22 years, and this is the only field of medicine that I have found to be so exact and so accurate, and to answer every question I've ever asked, okay? Even the questions I used to ask when I was on emergency medicine and did not have the answers to. This field of medicine, this Chinese medicine calendar has answered my questions. And in our office, we say there is no question too small to ask us. There is no symptom that we do not take into account. We like to know all the details, because believe it or not, those details are giving us a piece of your pet's story. And so that helps us piece together all the things that are going on. And so I know when I used to be in either regular practice or even on emergency medicine, if someone came to me and said, every night at 9:30, I start to get ready for bed and my dog just starts licking its paws excessively, I would say, oh, okay, one of the things we most often say is, well, maybe that's a nursing type behavior and they're starting to unwind, and so that's something that helps them to unwind. Well, that's still a possibility, but 9:30 just happens to be what we call a triple heater time in the body. And so if a pet has inflammation or allergies or a lot of heat trapped in the body, this is when they're going to actually start trying to overgroom or do acupuncture on themselves, because they are smart and intuitive animals. And so in Chinese medicine, we say there is no symptom that is too small that you can tell us that we're not going to take into account at our office. And we want to help teach you what to look for, and we want to help teach you how to balance your pet through the seasons. That is our goal. And I always say, with the clients that are coming to us, unless it's something for cancer, but with most everything else that we are treating, I ask that you give us that yearly cycle. We're not going to make you come to the clinic all the time, but that you give us that time, you give us patience, and you understand that the body has taken years to get to this point of this sick state, and it's going to take us time to rebalance and to heal. And it is inevitable that I'll have clients the year to the date that they were in our office will say, did you know that all my dog's symptoms have gone away or resolved? Or did you know that we came in at this time last year for this problem and we no longer have this problem? And so we have seen it work time and time again, but it only works when we really remember that we are not meant to heal quickly. Healing is a process, and so we do it in a timely, rhythmic manner, and we allow the body to regroup and restore and renew, and so that allows the healing to take place, and so we can see results. And this is one of the reasons why I wanted to put this video together, is because it hurts my heart so much to have clients come into my office and I'm all excited and I want to go over all of these things with them, and this is not what they want to do. Okay, this is no, we are looking for a quick fix, or no, we are not going to discontinue our 3-month Bravecto. You can hang that up. And so we need, for our clients that are coming into our office, to understand there are going to be some changes that we are going to ask you to make, not because we're trying to make your life difficult, but because we want to see healing and we want to see help. And over these years, I have studied how to get there. And I've always said in my life, there is no shortcut to any place worth going. And I say that in my clinic. I say it in my own life. If there's anything that we want to accomplish or achieve or do, it does take time. There is not a shortcut. We try to help you get there as fast as we can, but we are not able to wrap that up. We can't take a 14-year-old sick patient and have them back to health in 2 visits. It's just not possible. A cat, maybe. Sometimes cats respond quickly, but they can bounce back pretty quickly. But the majority of the time is we've had 14 years of sick care, and we're going to need some time to get your pet to feeling better or to restore some balance back into their body so that they can have a quality of life that we want them to have or that you want them to have. And so the other saying that I say at my office all the time, and anyone that knows me hears this a lot, is in consistency lies the power. Okay? So when we're consistent with something, we see the results. And so sometimes that consistency is a new diet. We see results. We may not see them in a week. We may not see them in a month. It may be 3 months or 6 months before we really see a change after we've adjusted that diet. But we do see the change when we are consistent, okay? And as I say with my cat owners or my small dog owners that maybe there is difficult to give them supplements and we may only do a tiny amount or a fraction of the amount, I always say it's in the consistency of that supplementation that we're giving, whether it's super small. It is the consistency of it and what it's able to do in the body as we give it time. And so those are important things to know about our office that we're going to talk about. Hey, this is going to take a little bit of time, and if you're willing to invest that time, then we are here to help you. Our goal is to walk every person along through their journey wherever they are. We get people that have been health fanatics their whole life. Like, I was raised by health fanatics, so I get that, and those are my people. And so when they come in, we are ready to go. I don't have to spend a whole lot of time going over much with them. But then I also get the people that just realize, hey, I need to change some things in my life or in my pet's life. And so we get those people that are just now coming to the forefront of like, hey, this is too much. My pets are getting toxic overload and I'm ready to change this. Or, hey, my pet just got a horrible diagnosis and I need some help with this. And so we are here to walk each person wherever they are in their journey along. And we're, me and my staff, the staff is trained to answer questions and, to help as much as they can. And so, know that if they're asking questions or, taking down notes, they're not just, randomly doing this. They understand these very principles that I am talking to you about. We see it all day, every day. And we do not take it lightly. I mean, every person that comes to us, we want you to know that, hey, you're not alone. This is extremely common. Sadly, it is. But we're here to help you, and we're here to do our best to answer all of your questions. And we're here to give you the information that we hope will allow you to make the best decisions for your pet's health. And so I hope that this has given you some insight into what our office is about and what you may expect when you come in. Some people, expect, because we are a holistic practice, that we are going to get to sit down and drink tea and talk about, the weather outside. That was always been my dream. Ever since I opened well-being medicine was that I could sit outside with my clients and just enjoy the day and whatnot. But because we are in Metro Birmingham, I mean, we are in, a city, and we are the only holistic veterinarian in this entire area. I mean, I'm the only one, and I know this from experience, that is trying to encourage our clients to change the way they are doing things, even if it is convenient, okay? It would be easy as pie for me to say, oh, keep doing this, or keep doing your, flea and tick meds, and keep doing your vaccines, and let me just kind of treat this little problem right here. That would be easy. But this is not an easy road. I did not pick an easy path. I picked a path where I wanted to see healing and health and wholeness. And that is a journey. It does take time. It does take an investment. And so we want our clients to understand that, but also to understand that we are a busy practice. And so I do want to spend that time with each person. And even if that I don't get to spend as much time on that first visit, we are always trying to spend time with each of our clients. And we want you to know that it is very important to us that you chose to come to our practice. It means a lot, and that we take everything into consideration for trying to help your pet restore health and have a wonderful quality of life, because pets are so important, and they mean the world to me, and we treat every single patient as if it were our own. And so just know that, and that when you come in, we are going to do our best to get to your questions and to spend that time with you. But we are a busy practice, and we never know what's going to happen that day when we walk in. Sometimes it's an easy, enjoyable day, but those are few and far between. We have a lot of patients that we always want to be available for, and so we are busy, and we just want you to know that ahead of time. But that does not mean that we are not here to take individual care of each patient. And so we look forward to meeting you, and we look forward to helping you in any way we can. And we hope that we're able to encourage you to do some things differently. And I'm going to have some other videos as I continue to work on my online program for detoxification and that sort of thing. I'm going to put up more videos, and those will be offered to our clients. So you'll be able to get more in-depth information on hepatobiliary circulation, the MTHFR gene, and methylation, and how detoxification can be affected by those genes, and the testing that we do right now to determine that. And so we'll get into a lot more of those videos, and they will be available in the future. But right now, I just wanted to give a lengthy introduction into what our practice is like and what you can expect working with us. And I hope this will encourage you to come in and see us. Okay? And I hope you have a wonderful day, and we will look forward to meeting you soon.